sure we introduce ourselves and get going. But I know this. Whenever I co-host a webinar like this, my colleague from New Crop here today, Brian Farley, I asked him, what's your title? How long you've been with the company in preparation for this? But he also said he had a hobby of poker playing and chess. Now, getting into chess, I see it maybe a little bit, but how'd you get into poker?
Actually, chess and poker, I think there's a lot of overlap in the skill sets, a lot of planning ahead, a lot of analysis and that sort of mindset.
Okay, I see you're talking to somebody who doesn't understand it as well, so that's good. That's very interesting. I would love to see that in action. A couple of the partners in the company have played chess with me, and I was playing checkers, so it wasn't that fun, if you know what I mean.
Fair enough.
Well, we all have our strengths, right, Brian? Well, today we're probably going to give it 30 more seconds here. So I'd like to thank the people that show up. I'm going to thank Brian Farley, who has been a product owner with New Crop for 13 years. So not your first rodeo, right, Brian?
No, sir. Yeah, I've been with New Crop for a long time now, and I hope to give you all a full tour here, abbreviated.
That is, you know what? That's our goal as well, because today we're the system that serves as a platform for billing, scheduling, documentation, compliance, trying to manage your practice in a bunch of different ways. But we noticed that by ourselves, Brian, we can only go so far. But together, this system with partners like New Crop can go much further. For those people who are looking to talk about nutrition, supplements, injections, and some prescriptions, that there are skills that you can have by looking things up elsewhere. You can have books that you can look up, right? It's all time consuming and potentially a little dangerous, right? You can get some of those things wrong. So today we're going to talk about how a partnership with an organization like New Crop can really, really help. And our system would never have these resources on our own like New Crop. So we're actually going to get into it today. And the whole purpose of this is to highlight whether or not this partner has services that will end up helping you in your practice and ultimately your patients. So for those people who are looking to streamline things, we've invited Brian Farley on here to help us. He's going to start sharing his screen and going through the value add.
Thanks, Jason.
Appreciate you.
Well, so thank you all for attending. I am just going to go ahead and introduce you all to what New Crop provides and adds to the system. One of the key things that I want to point out, first of all, is just how intrinsic electronic prescribing has become to a full EHR system, a full PMS system. It's just a necessary piece now. Laws have changed. More and more states are requiring this. PDMP integration is being required. You'll hear Medicare and Medicaid pushing these programs, and ONC, NCPDP, you name an acronym, they're all involved now. And
that was so we had to do this, right? So we're a certified system, Brian. So that's how our relationship started, making sure that we remain compliant for all those providers. And for anyone who doesn't know what that ONC is, if you're listening right now and you don't know what it is, that doesn't mean it won't apply to you at some point. Just know that this wave is coming, and it's using a system that's been certified with all the specs that the United States government requires. Brian, I'm going to keep doing that to you. I hope it's not a huge deal.
No problem. So because of that, electronic prescribing, especially with your scheduled medications, not only is it a time saver, but now it's a requirement. And I wanted to point out how it can be a big time saver with some specific cases. And I'm going to go ahead and share my screen now. And you'll see a little bit of Nevada in the background there, but go ahead and
that's okay.
Open this up. So this is our tasks page, and the idea behind the task page is this is where you land to take care of messages that come in from the pharmacy. This can totally replace the phone calls that you might be receiving, the faxes that you might be receiving from the pharmacy with questions about prescriptions, with renewals that they are requesting, where the patient came in to get a refill from the pharmacy and they're out of refills on the original prescription. This allows the pharmacist to actually communicate with the prescriber directly, electronically, removing any ambiguity of a phone call or a written note, and getting a very concrete message from the pharmacist to the doctor, and allowing the doctor then to reply. So these can be great time savers for a practice. And so renewal requests are just as I mentioned. This is a message from a pharmacy. This is saying, hey, this patient wanted another refill of this drug. This one happens to be OTC, so this probably isn't a real world one, but this is the idea. And if you ever needed any details about any of the specifics, every aspect of that message as it's sent to you is at the top, and then the response that you're giving back is listed down at the bottom. And you have the option here to approve this as is. You can modify the refill count that you're approving. You can deny it. You can replace it with a completely different drug if you need to. Your active medication list, what the patient is already taking, is right here listed underneath. So this, if you want to make sure that the drug that they're taking is, or that the pharmacy had on file, perhaps it's out of date, you can confirm that this was the last way that you told them to take it. You can confirm that there's no interactions, which we would display at the top. All this is handled pretty automatically in a nice, smooth, one-shot sort of experience. The patient safety benefits of having all that information in one place, easily presented, it just adds to the whole workflow that we've created here. Change requests are a little more sophisticated, and like I was saying, this can be any sort of message from the pharmacy. And so this can be if a PA is required. They can send back a message telling you, hey, we need a PA number for this prescription. And we'll give you, if that's the case, we'll give you a spot to enter the PA number. But beyond that, we'll give you a link just to go ahead and process that, to begin that PA if you hadn't started one already. They may tell you that they wanted to substitute the med. Maybe you wrote DAW on the script and they want to substitute the generic. They may request a generic substitution. There's a number of different possibilities here. They can show you up to 4 or 5 different alternatives that they're suggesting, and that can all be handled from here. And again, you've got your details broken down of the message and what you're sending in reply. So as far as a time saver goes, I really wanted to point that out in particular. Just because that is one thing where a lot of time is just wasted in practices today.
Right. One interruption there, Brian. If anyone
Yeah.
has a question, we've got a chat function and a Q&A function. I see a couple of people, typing away, but nothing's come through so far. But I just wanted to let everyone know that they can type those in there and we'll respond.
Yeah, absolutely. So as far as the other benefits, the other thing that I was touching upon is that, one of the things that you get out of this is just the integrated interactions checks and alerts. We have embedded allergy checking. We have embedded drug age, meaning both geriatric and pediatric checks. Drug disease. So if the patient, as long as the diagnosis is entered for the patient, we are going to check that those medications don't have a negative influence on a particular diagnosis that you've already assigned to that patient.
And those are automatically pulled from the system as it stands. So nobody needs to re-enter those.
Right. Yes, sir. And one of the things that is new and is pretty neat that a lot of people aren't really taking full advantage of yet, but it's kind of the future, is the genomics. And So if a particular drug has a potential genomic reaction, that's going to be identified straight away. We're going to throw up an alert, just like we throw up any other interaction alert, and let you know that the given drug may have an interaction based on the patient's genome. If that's the case, then that will be displayed as a potential alert. But beyond that, what you can always do is you can request a genetic test for the patient. This is no charge to you. It is billable to the patient. If the patient signs up for this, gets their genetic test, it's a lot like 23andMe, if you're familiar with that. Then the results will be specific to their genome. So instead of getting potential alerts, you'll start getting alerts very specific to that individual. So it's a very interesting tool. You can find out this particular patient requires a higher dosage of a given drug. You can find out that a particular drug may not be effective for the patient. It can save time, and it can certainly save a lot of wasted therapeutic time for the patient. When you're prescribing, another big time saver is the real-time benefits capabilities. And so here, for example, I'm writing a prescription. I'm notified right away that a prior authorization is required. So, I can know, hey, maybe there's a better alternative to Lasix. Depending on the patient's health plan, we will show you the alternatives. This patient doesn't have a health plan. Again, these are test patients, so sometimes the data doesn't always make sense. But in the real world, if it's a brand, the PA is required, it would probably show you the generic and where the PA may or may not be required. So that's these tools all are meant to save time and to protect the patient at the end of the day. And here's an example of those alerts that I was mentioning. I just wanted to share those quickly. You can see a genomic potential alert here was brought up for the Lasix. And you can always click on the links, and you can get to, well, normally you can click to the links and get to the detail on the given interaction or alert. And I'm glad that we finally ran into, I knew we would eventually run into one of those rules of demos where something goes wrong. So,
We've never
but
that's odd for us. So it always works when we do it.
So yeah, so this is routinely you'll have those. The short version is always going to be surfaced right here, but then at the link you should see more details. And again, I'm in the staging environment, so it's a little bit less stable.
So question about interactions with allergies, let's just say, or whether or not you're going to use a certain type of injection and the patient has an allergy. How would they see that?
Allergy alerts show up in the same field. So for example, if this patient has an allergy to rosuvastatin, you would enter that allergy, presumably in the core system. Correct? I believe I have that right.
You're correct.
So that information gets pushed over here. So y'all would have this automatically loaded. You wouldn't have to go through these steps that I'm taking right now. But then when I come in with this patient, I can see the allergy on our compose page. But then more importantly, if I'm going to go ahead and delete this one so it's real clear cut. I'm going to take and prescribe a Crestor, which is really, that's the brand name of rosuvastatin. But if I didn't realize that, I would immediately get an alert like this telling me, hey, this is a severe alert. This is a allergy alert. Any sort of allergy alert is going to trigger this, or a drug-drug interaction that is listed as either a high risk criticality or a high severity, like as either severe or contraindicated, is going to interrupt you right away and force you to confirm, hey, I really want to prescribe this regardless, or more likely, no, I just want to cancel this and find something else.
Thank you.
Yeah, no problem. Any other questions on the prescribing alerts and the workflow?
No other questions coming in right now, but when it comes to, getting this integration working, this integration has been working for, I believe we came up with 7 years now that we've had this up and running. So this is not new. Our users wouldn't be running into something that's not stable and vetted. This is something that we're making sure that a lot of our multidisciplinary practices who need some documentation, and actually to make sure that they, were compliant and took the steps necessary to make sure that they checked all of these things, have a tool that's super simple to use. So if you're watching right now and you have questions about how it would work in your office, make sure you ask them to us. If not, we can always show you how to get those answers, before you sign up, and we'll make sure that you're good to go there. So those are the last things I wanted to point out before we told them actually how to use it, Brian.
Fair enough.
All right.
Well, I will go ahead and hand off to you then, Jason.
Yeah, sounds great. So out of the hundreds and hundreds of practices, actually almost 1,000 now that we have, we've got almost 30% of them that are multidisciplinary. And what that means is that there's a lot of them that have a need for this. So as I go to share my screen, I want to make sure everyone sees what we're talking about. So here is a roster of patients that are checked in. You've clicked on your note for the day, and I'm going to move over to something that's already done. I don't want to run into that demo issue that sometimes we run into. Brian can relate, where you click on this icon over here, and this particular integration actually shows up right in your documentation screen. So you can see it from, this is one of 2 ways where you can actually see it. And so for us, you're able to see that the patient has already been loaded, all of their relevant information is already in there that you've put in there, and now you can do whatever work you need to do in order to make sure that that patient is being taken care of. So if they have a whole bunch of active medications and you're going to administer an injection, right, you have to have those listed. You have to prove that you've asked those questions and you've got them written down. So we have this all in one place, and it creates the documentation trail that you need to make sure that you stay compliant. And now we get on to, I think, one of the best parts, Brian, because this isn't that hard to set up, is it? Pretty simple, right?
Yes, sir. Yeah, this is, like you're pointing out, it's built into the system. You will need to sign up for it, but beyond that, if you are doing scheduled drugs, there is a identity proofing process where you go through, answer some credit history questions to confirm that you really are who you say you are. But beyond that, it's all integrated. Your user role in the system is going to carry over into the new crop prescribing module.
Perfect. So, when it comes to that, it really is quite simple to get set up. You can just go to our store and subscribe, and then you're up and running. And one of the biggest reasons, Brian, that we are talking about this again is you guys just recently changed your pricing model, right? So we have a new pricing model for prescribers and then users, right? So the prescribing dollar amount was, I believe it's 48, and that's dollars per month. And then there's a new prescribing model for just pricing model for just the users of the system who are not prescribers. So that used to be all just one, where it was just one cost of 30-something dollars per user in the system. Now we've broken it up so it's much more cost effective, for other staff members to go in and do a lot of the legwork that used to be, charged for at a much higher rate. So the rates have come down and we're looking much better. We do have a question, as a matter of fact. We have Asanya Fluid, who is asking a question that I don't know if I can show the answer. They're saying, how do you prescribe? They missed that part. Do we need to get you back sharing your screen?
Yeah, I can go ahead and grab the screen real quick.
You got it. I think I need to stop sharing. So I just did that.
All right.
Get it again.
Yeah, there we go.
Perfect.
Sure. So yeah, if I'm writing a prescription, I can either write one from scratch, or probably more commonly, more frequently, you're often just going to check something from the active med list, something that, if I wanted to renew a med, I would just check that med, click prescribe. That'll take me over to the transmit page. I've got the last pharmacy I was using for this patient is going to be defaulted, but I can switch to another pharmacy if I'd like. And then I'd click transmit. That'll send that out the door. Alternatively, if it's a new med that I'm putting the patient on, I can go ahead and just do a drug search, and I can see the different options that are available, as well as the different coverage level. Again, this patient doesn't have a health plan, so I'm just getting an unknown for the coverage level. But I can select the med, and I'm taken to a sig builder that's appropriate to that medication. So in this case, it's going to default to our open sig builder. But if you're doing an insulin drug, we've got a custom sig builder that makes it easier to write something for insulin. So you can quickly do something like this. And then we've got a vaccine one, again, focused around writing for vaccinations. And if you've got something really complex where you're doing, take 2 in the morning on Monday and 3 in the afternoon on Monday, and then 4 in the morning on the next day, you can do really complex SIGs. This can support up to 200 characters in here, and or excuse me, 140 characters in here, and you can type, really whatever you'd like. So that gives you a lot of flexibility to handle those oddball scenarios. But say I'm more commonly doing, one tablet by mouth, we'll pre-select the form and the route for you. And you have the options to come in here and quickly specify, as needed for a headache, as needed for what have you. You can specify timing modifiers, etc. You can say, hey, I need this particular brand. And you can indicate a maximum dosage, associate a particular diagnosis with that given prescription, which can definitely be necessary for some insurance plans to cover the med.
Let me interrupt. She just clarified another question for us. So she's got that, but she wanted to know now, well, how do I sign up for this feature? So I can take over that one. Okay.
Alrighty, fair enough.
Oh, sorry about that. So let me go back to sharing the screen and taking care of that. Asanya, we're on this. We're gonna get right back to you here. Okay. So, okay, once you're in the system here, right, and you guys have signed up with New Crop, they send over an item here, and now you're going to have this available in your app store from now on. So if you click on your app store, as long as you've signed up, you contact New Crop, and you sign up, you are going to come over here to your app store, and you're going to see New Crop in there, and you're going to be able to subscribe on that one. So feel free to use this app store. It's how we sign up for almost all of our things now, and we just moved this into the app store, so it's much easier. Now, the other part that they're going to show you, you're going to have somebody contact you, because we need to understand which users are going to be prescribers and which users are not going to be prescribers. So there's one more step after that, but we will contact you to make that happen. Does that answer your question? So let me make sure. She said, got it, thank you. So, all right, any other questions? So, Ryan, the last call to action is if they head to your website, if they go to New Crop and want to get signed up, is that how they're going to do that?
So typically what's gonna happen is it's gonna be activated in the system. And then y'all would surface the link that, the button or link that takes the user to our system.
Oh, so they're gonna subscribe first. All right, I just don't have this in my demo account. I thought we needed to get it from you guys first. I'm just being messaged by my team member that changed. This
Oh,
changed.
okay.
So I apologize. We're gonna have new crop in everyone's. We just don't have it in our demo account just yet. So it will be here, Asanya, and everyone else who's listening. I got that a little backwards. So new crop will be in your app store starting tomorrow. So we will make sure that that's there for you. So click on your app store and you should be able to get it done.
Fantastic.
Yep. All right. Well, Brian, I think that we've got one more question. Can you show what I click on in the document and bill? Oh, to get to the new crop. Yeah. Matter of fact, I can. So let me just refresh this. And this question comes from someone named Amy. We might be running into that demo problem again. It's never happened before, and you knew I was lying about that one, right? So let me just close this. We'll duplicate this one just so it comes up. Shouldn't take but a second here. What I meant is it's not going to take that long at all. Let me just refresh the screen here. All right. For some reason, it took me out of the demo account and we're going back in. Luckily, there's no information there. That's all right. So Amy, this will be 2 seconds once I actually bring the screen up. So as the patient comes up from the roster, you have a toolbar here on the right-hand side. Okay, this toolbar, once you're subscribed, will have this new RX function, right? And that RX function is what is the icon that you click on to bring up the new crop function. Make sense? Hopefully, if you can let me know if that answers your question, that'd be great. All right. Any other questions before we get off today? Yep. Correct, Amy. That is right. We'll have the App Store up and running. And then a member of our team will be in touch with you because we have to identify which users. So we will make sure that, if you have, one prescriber and 3 other users, we'll make sure we get those identified and set up, and then they'll all be able to access new crop, which is one of the newer things. Amy, we're glad this was helpful. Thank you for being here. Just so you know, Brian, she was just thanking us. I took most of the credit. I think you were here.
Sounds good. Thank you, Amy.
All right, guys. Well, then we're going to bring this one to a close. Thank you so much and have a wonderful day. Brian, thanks for being here.
Thank you.
All right. Appreciate you guys. Thank you so much. Bye.